Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Colorectal polyps and its classification. So broadly, it is classified as neoplastic and non-neoplastic. Now let's look at what is neoplastic. So neoplastic means there is adenomatous polyps. So there is the adenomatous. So there is adenomatous polyps. So adenomatous polyps, it includes, there is a tubular adenomas, there is tubular, so there is tubular adenomas, and this tubular adenoma is MC, that is the most common. Next is the tubulovillous adenomas, tubulovillous adenomas. Next, what we have is there is the villous adenoma. There is presence of the villous adenomas. So the villous adenomas, it has a very severe degree of malignancy. Next, moving on to the non-neoplastic. So in terms of the non-neoplastic, so here there is a hyperplastic, it is hyperplastic. Then there is also the hematomatous. There is hematomatous. So under this, it includes the juvenile polyp. So the juvenile. So this presence of the juvenile polyp. So this juvenile polyp is nothing but it is solitary. It is benign. Next is the juvenile polyposis syndromes. There is juvenile polyposis syndromes. So this is nothing but it is multiple. So this is nothing but multiple. It is pre-malignant. Multiple, that is pre-malignant. So then comes the PJ. PJ means the Peutz-Jeghers syndrome. This is occasionally carcinoma may develop. So occasional carcinoma, it may develop here. So then there is a CC syndrome. What is CC syndrome? It stands for the Cronkite-Canada syndrome. So let's add a note on this. So this is where the cancer occurs in the stomach. So here the cancer, it occurs in the stomach as well as the colon or the rectum. So stomach, colon or the rectum. But it remains controversial whether the polyps possess a malignant potential. So the malignant aspect is a question mark. And as many as about 15% of patients with the CC syndrome have malignant tumor at the time of diagnosis. So at the time of diagnosis, they have a malignant tumor. So the percentage here is 15%. Now what are the other points? There is inflammatory. This is under non-neoplastic only. So there is inflammatory. Under inflammatory, it includes the pseudopolyp. So there is a pseudopolyp as well as the benign lymphoid polyp. There is benign lymphoid polyp. To learn and grow daily like this, please do subscribe.